Have you ever stopped and asked yourself, does masturbation really change as we age? I know it's not a topic most men feel comfortable discussing at the dinner table. Many assume it stays the same whether you're 20, 40, or 70. But here's the truth. Our bodies evolve, and so does the way they respond. I'm Dr. Ella, a urologist with 7 years of experience helping men understand the changes that come with aging. Today, I'm going to reveal something most men over 60 don't realize. They're often doing it the wrong way. Stick around, because the last mistake I'll share is a quiet confidence destroyer, and most men don't even know they're making it. But first, if you're watching, hit like, drop a comment telling me where you're tuning in from, and subscribe. Trust me, the next 15 minutes could transform the way you connect with yourself and your partner. Now, let's get started with the first truth. Masturbation isn't harmful or risky after 60. When done right, it can boost circulation, support prostate health, and even help maintain stronger erections. The issue is, many men keep doing it the way they did in their 20s. Fast, rough, and rushed. That method might have worked back when your body was overflowing with hormones and blood flowed effortlessly. But now, the same approach can quietly harm circulation, lower sensitivity, and put unnecessary stress on your prostate. The good news is, the right way after 60 isn't about stopping. It's about adjusting smartly. Let me explain it like I would to a patient sitting right in front of me. Over the past 7 years, I've seen men struggle with performance problems, reduced sensitivity, and frustration, just because they didn't change their habits as their bodies aged. The science is straightforward. Arteries stiffen, testosterone declines, and nerves respond more slowly. Mix that with decades of fast, high-pressure routines, and you get the perfect setup for weaker responses. But here's the encouraging part. Small, mindful changes can reverse much of this, almost like rewiring your body for better sexual health. So, let's go over the top mistakes men over 60 make and how to correct them. Mistake number 1. Rushing through it. Remember the old days when everything was urgent, arousal hit instantly, erections came easily, and finishing quickly was second nature? That worked back then, but now rushing only works against you. Here's what happens in your body. Fast, aggressive stimulation limits oxygen-rich blood to your erectile tissue. Muscles tighten, arteries narrow, and sensitivity drops. Emotionally, you might feel frustrated or unsatisfied. Practically, you could notice soreness afterward or weaker erections. The solution? Slow it down. Treat it like a long, relaxing walk instead of a sprint. Take deep breaths, let blood gradually fill the erectile tissue. Give your nervous system a chance to relax into rest and restoration mode. Mistake number 2. The death grip. Many men use a very tight grip, known as the death grip. It might have worked when you were younger, but over time it can desensitize nerves and train your brain to need very intense, specific stimulation. Biologically, this lowers blood flow and dulls sensitivity. Emotionally, it can make intimacy with a partner feel less satisfying. Practically, you may notice that you need more pressure just to feel the same level of arousal. The solution? Ease up. Use a lighter touch, vary the pressure, and retrain your nerves to respond more naturally. This not only keeps your sensitivity intact, but also makes real-life intimacy far more enjoyable. Mistake number 3. Skipping lubrication. Here's a common myth. I shouldn't need lube. If I do, something's wrong. That's completely false. Lubrication is a tool, not a sign of weakness. It prevents skin irritation, supports healthy blood flow, and helps your nerves respond properly. As skin gets thinner with age, lube protects delicate tissue and preserves sensitivity. Think of it like oiling a machine. It keeps everything running smoothly. Mistake number 4. Ignoring posture. Posture is more important than most men realize. Sitting hunched or locking your knees can compress arteries and nerves, limiting blood flow to your pelvic area. Try lying on your back, standing with relaxed knees, or gently opening your hips. Combine this with deep diaphragmatic breathing. Inhale through your nose and let your belly rise. Then exhale slowly through your mouth. Oxygen floods your bloodstream, boosting nitric oxide, which relaxes arteries and supports erections. Think of your body like a hose. If it's kinked, the flow is weak. Straighten it, and the flow is strong and full. Small changes in posture and breathing can make a huge difference. Mistake number 5. Thinking frequency is harmful. Some men over 60 believe they should stop masturbating to save energy or protect their prostate. That's not true. Regular ejaculation actually supports prostate health. It clears old fluid, prevents buildup, and keeps blood vessels and muscles active. Biologically, it's like exercise for your reproductive system. Emotionally, it boosts confidence and reinforces self-care. Practically, aim for 2 to 3 times per week, balancing stimulation with recovery. Listen to your body. Soreness or fatigue is a sign to slow down. Mistake number 6, ignoring the mind-body connection. After 60, arousal isn't just physical. Stress, anxiety, and shame can tighten blood vessels, reduce blood flow, and weaken erections. Shift your mindset. Treat masturbation as a form of intimacy with yourself. Slow down. Breathe deeply. Focus on the sensations and let your nervous system relax. Remember, your brain is your largest sexual organ. When it's calm and engaged, your body follows. Mistake number 7, relying too much on adult content. Many men lean heavily on pornography. At first, it might feel harmless, but over time, it desensitizes both your brain and body. You may notice erections take longer or feel weaker without a screen. This is a dopamine issue. Constant artificial stimulation dulls your reward system. The solution: gradually cut back. Reconnect with your imagination, memories, and physical sensations. Your erections get stronger, arousal builds naturally, and intimacy with a partner improves. Think of pornography like junk food: quick rush, long-term weakness. Real intimacy, with yourself or a partner, is nourishing, energizing, and lasting. Here's your roadmap for mindful masturbation after 60. Slow down and let blood flow naturally. Use a gentle touch. Avoid the death grip. Apply lubrication to protect delicate skin and nerves. Pay attention to posture. Keep arteries open and blood flowing. Breathe deeply to support nitric oxide and relaxation. Balance frequency, aiming for 2 to 3 times per week, and listen to your body. Engage your mind, reduce stress, and cultivate presence. Limit screen reliance. Even small changes add up. Firmer erections, improved sensitivity, and a richer sense of pleasure are completely within reach. I want you to hear this loud and clear. Age does not mean the end of your sexual vitality. You don't have to settle for frustration, numbness, or low confidence. Your body is fully capable of responding beautifully, even now, if you treat it with patience, respect, and care. This isn't just about sex. It's about dignity, self-confidence, and living life to the fullest. Here's my promise. By adjusting your habits and focusing on posture, touch, breathing, and mindful engagement, you can rediscover pleasure in a deeper, more satisfying way. Your best years aren't behind you, they're right now. Small, consistent changes today can give you freedom, confidence, and comfort tomorrow. If this video helped you, hit subscribe, leave a comment with your thoughts, and share it with a friend who could benefit. Take control of your body, your pleasure, and your confidence. Remember, being 60 plus isn't about giving up. It's about rediscovering strength, sensitivity, and joy. And it all starts with how you care for yourself. Like, comment, subscribe, and start today. Your body and your confidence will thank you.